Good morning, friends. As previously discussed, today we are going to talk about the remaining terms of Rachana Sharir related with head and neck, or you can say skull, back, and some terms related with embryology or Garbha. Let's directly start the topic. So first of all, we are going to talk about the some terms related with the skull. So skull or head and neck region, you can say simply we are going to talk about it. The first word is Sira, or also called as Uttam Anga. Short definition is this is set for the head region, and this is the site where prana and indriya. Indriya means the sense organs which are situated here, which is the uppermost part and the chief part of the body. But it is situated at upside and controls all other parts. It is said to be the Uttam Anga. Next, there is Kapala. Kapala means the flat bones which are covering the skull, or you can say which are covering the brain, you can say. So here's the short definition is skull or cranium, bones forming the skull. Kapal is a type of asthi also. We are going to talk in detail when we are going to talk about asthi. Then next word is sankha. Sankha is temple, area on the side of forehead. This particular part is called sankha. It is just about to the ear lobules. This is sankha. Then comes lalat. Lalat is forehead. This part, forehead, the anterior part of head below the hairline and above to the eyes. Then Akshi, Akshi is eye, that is organ of vision. Then Nasika, nose, it is a structure which is on the anterior aspect of face, serving the function of collecting, filtering, and humiditying the air from the exterior and also the function of olfaction. So it is a sensory organ. Then there is Karna. Karna is ear lobule. It has three parts: outer ear, middle ear, and inner ear. Then there is a mukha. Mukha means mouth or oral cavity from this particular part from where we are going to take the food. Then there is anana. Anan is for face. This whole thing is called face. The face as a whole. Then there is hanu. Hanu means jaw. The bony structure of lower jaw, or you can say mandible. Then there is danta, dasana. Both are synonym for teeth only. Teeth are also considered to be a type of asthi as per Ayurveda. We'll talk how they are different or how they are similar to asthi when we'll talk about asthi. Then there is jiva. Jiva means tongue, that is freely movable muscular organ lying partially on the floor of mouth and partially in the pharynx. Then there is kantha. Kantha can be called as front of neck, or you can say larynx or thorax. It is the anterior part of neck and closing the pharynx and larynx. These two are the organs which are in the behind the, you can say, the neck region only. Then there is gala. Gala can be said to the oropharynx. Pharynx is divided into three parts. So one of them is oropharynx, which is behind the oral opening. That particular thing can be called as gala, or throat also can be same thing. The central portion of pharynx lying between the soft palate and upper portion of epiglottis. Then there is gull nulcum, that is trachea, the large upper end of trachea below the root of trunk. Then there is Asru Marga, or something related to Asru means tears, that is lacrimal apparatus, the structures concerned with the secretion and conduction of tears. Then there is Mastulunga, Mastiska, or Gritika. These are synonym for brain, or you can say cerebral part. The part of central nervous system situated within the cranial cavity is called brain. So Mastulung, Mastiska, or Gritika, they will be called for the brain ke liye. Then there is a word Avutu. Avutu is the nape region of the neck. Nape means back of the neck. Nape region means back of the neck. So this is Avutu. Then there is Cricatica. Cricatica is the name of joint. It is also a nerve also. It is the joint between L10 and occipital. That is atlas and occiput, where our head is kept on the axis and it is going to be rotated. So this is also a type of Jatru Urdhva Marma. Then there is Prishta. Prishta means backside. The whole of the back can be called as a Prishta. So we are going to learn some marm which are present on the Prishtagat marm. There are some muscles, there are some fasces which we are going to talk in detail. So posterior part of trunk is called as Prishta. Then there is Kaseruka or Prishtvansha. These are vertebrae which are present in the vertebral column. So all these will be called as Kaseruka or Prishtvansha. There are separate name for each of them also region wise, but in total they are going to be called as Kaseruka. Then there is case angajam. It is set for the hair, whatever hair we are having in the head region, that is the epidermis part. Now we are going to talk about some terms related with embryo or garbha. So first of all, what is Garbha? Garbha is embryo or fetus, the product of union of Sukrasonit and Jiva. We are going to talk in detail of this. It's big and very interesting topic, and we will be surprised to know how well the embryology is defined in our classics. Then next word is Garbhasaya or Garbhasaya, means where the garb is going to reside temporarily for certain time, that is uterus. Receptacle for fetus, the organ of female reproductive system for containing and nourishing the embryo developing. Then there is a word called as Garbhakosa. Garbhakosa is the membrane which are covering the fetus, that is bag of fetal membranes that are holding or are developing fetus or embryo. Then there is a word Garbhasaya, again uterus. Then there is Garbha Koshta. Garbha Koshta, Koshta we have already talked. Koshta means cavity, and it is Garbha cavity, that is uterine cavity, the cavity of uterus. Then there is Garbha Chidra. Chidra means opening. Os uteri or mouth of uterus is called Garbha Chidra. Then the word is there Nabhi. Nabhi is also said to be then organ also as per Ayurveda. We'll talk about it. But right now we are going to take it as a scar or depressed mark. That is umbilicus. That is point in the middle of the abdomen scar that is left after the former attachment of umbilical cord. But Ayurveda says this to be a origin of many different particles is the place for Agni also. Next word is apara or amara. These are two words which are used for placenta, that is oval or discoid spongy structure in the uterus through which the fetus derives its nutrition after 4 months. Then there is a word Nabhi Nadi. Nabhi Nadi means which is connecting Nabhi with the fetus, that is umbilical cord. Next is Nabhi Bandhanam, fetal end of umbilical cord. Means from where the fetal end is umbilical cord, तो जहाँ पे भी है उसका नाम क्या होगा? Nabhi Bandhanam, the fetal end of the attachment connecting to the fetus with the placenta. Then there is Karmuk Bija. Karmuk Bija means a healthy sperm or ovum, or the gametes we can say, the normal, healthy and effective sperm which can go for the reproduction and produce a good progeny. Stri Bijam, ovum. Reta, that is semen, whole of the semen is called. Then there is a word called Sukra Dhatu, all the reproductive fluids. The seventh dhatu is called Sukra Dhatu, having the function of reproduction, which is generally equated with semen, present in two forms, former pervading the entire body and the latter which fertilizes the ovum. And it is dominated with Jala Mahabhuta. Then there is a word called as Artava, Puspama, Artava Sonita, Anta Puspa, Rajasrava, Sonitam. And these all words are set for in different places for the menstrual blood. So monthly periodic physiological uterine bleeding through vagina with the duration of 3 to 7 days, symbolizing the forthcoming fertile period. So this all words are used in different places, but they are going to tell you about same thing, that is menstrual blood. So all this word which we have talked till now, they have been taken from the Namaste portal and have been arranged in as per the requirement. So this was all about the important terms which we should know before we are going to enter in the world of Rachana Sharir. Now when we are going to learn this world, we have understood this world, then it will be a bit easy for you to understand the further theory. It's better you make the notes for this and in the front of your notes copy or register, so that whenever you require, you can just look after them and slowly they will be summarized. Thank you.